Hi, how you doing? My name is Dr. Eric Miller. I'm with Chiro-Med Health and Wellness Centers located in Orland Park, Illinois. Today's topic is going to be about human intervertebral disc diseases. Let me have you scan into this model very quick. I want to get a definition about what the disc does, what its purpose is. When we look at the disc, what we see is a gelatinous center called the nucleus pulposus, as well as a cartilaginous fibroelastic layers that surround it to contain the jelly-like material inside. The purpose of this disc is to act as both a spacer and to add flexibility through the spinal column so that we can move with good flexibility. The disc needs that flexibility to actually get nutrition into the disc. The disc is a spacer for what's called the intervertebral foramen, which is the holes where the nerve comes out between each and every vertebrae. So they're very important. There are a few things that basically cause problems with discs. I mean, you've heard of disc bulges, disc prolapses, disc herniations, disc degeneration. These are the four things that generally happen to discs over time if there's problems with them. There are a few different ways to actually cause problems with the disc. One would be something traumatic, such as an accident, slip and fall, car accident, something that causes a shearing force through the disc. It's normally when the body's flexed and rotated when lifting something, or if you're in a car accident and your body goes forward, and it actually compresses the disc and spins it, and that creates a tear or fissure in the disc, and then that disc will herniate at that time. But the most common way that discs become pathologic is by abnormal stress, wear and tear over time. So what can actually cause that abnormal stress? The biggest cause of abnormal stress to a disc over time is misalignment. So when the vertebrae are misaligned, they're going to basically be putting abnormal stress through that disc over time, and that abnormal pressure is going to create cracks and fissures in the outer layers of the disc, and that jelly-filled center is eventually going to migrate towards the path of least resistance and create a bulge. I'm going to show you what that looks like on x-ray right here. This is a typical x-ray of someone that has a disc problem. He's got a disc herniation. When he presented to the office, we did an x-ray to see what his alignment looked like and to get a good diagnosis. When we looked at this, the first thing we would look at is to make sure that the iliac bones are the same height from side to side. And that looks pretty good. We also check out the hips to make sure the hips are aligned from side to side, and that looks good. But what we see in this is that the sacrum is slightly tipped and the L4 vertebrae is laterally bent on the L5 vertebrae. So this misalignment has been causing stress to the disc, which is represented in this little red drawing that I made here, and the stress, how it would push the disc towards the side of least resistance. Now he's had stress to the L5-S1 disc as well, and we're seeing degenerative changes at that particular level between L5 and S1 because this has been going on for a long period of time. The longer that you have stress on discs and joints, the more likely it is that you're going to have arthritic changes and degenerative changes because of that. Now I want to look at this MRI. So this is the same patient, and when we look at an MRI, basically what we want to see is nice white discs on this particular view, nice gray discs on this particular view. But what we want to see is that the discs are well hydrated. So discs need nutrition. The nutrition of the disc is made by a pumping motion via motion through the vertebrae. So if a vertebrae is misaligned or stuck, it can't move properly. The discs don't get their normal nutrition because they're not being fed through what's called convection. So a disc that is healthy is going to serve its purpose as a spacer. It's going to allow plenty of space for the nerve to come out behind that particular vertebrae, and it's going to allow motion through the segments so that things can stay healthy and you can withstand stresses that are up to 10 times your normal body weight. If we look at this particular picture, you can see what a disc herniation looks like. We see that the disc is actually bulged backwards into the canal, and it's actually broken through the outer layers that are called the annulus fibrosus and into the canal. What happens when this particular situation occurs is that there can be pain in the spine. Disc problems cause a lot of spinal pain. And it can be neck, mid-back, low back, it doesn't matter what particular area, but the disc is innervated by a nerve called the sinovertebral nerve. It's pain sensitive, and you can have spinal pain just from disc pathology. But another thing that can happen is the disc can actually bulge and create pressure on a nerve that exits. I'm going to show you with this chart. If you have a nerve in the neck, that can actually, or a disc bulge in the neck, that can actually irritate a nerve going down the arm. Or if you have a disc problem pinching a nerve in the lower back, it can actually create pain like sciatica going down the leg. There are different types of disc disease. There are different diagnoses. The first one is a disc bulge, which basically means that the jelly-filled material in the center of the disc is still contained within the outer layers. So you basically have the jelly-filled center, again, the nucleus that's contained within the outer layers. And it bulges outward, and again, that can be pain sensitive, but it can also be putting pressure on the nerve. The next thing would be a disc herniation. So when the jelly-filled center actually migrates through the outer layers and it produces a herniation, that material is now out of the area that it's supposed to be, and it can have a direct effect on the nerve. The body also perceives the disc material, the jelly-like material, the nucleus, as a foreign substance when it's herniated, and it creates an inflammatory reaction, and the body will actually lay down white blood cells, lymphocytes, macrophages that are part of the inflammatory cycle, and that in particular can also occupy space that can pinch the nerve. So it's good to get an anti-inflammatory effect in that particular area as soon as possible to take the pressure off the nerve, get rid of the inflammation as much as you can so that you can take the pressure off that nerve as quickly as possible. The longer that you have pressure on a nerve, the more likely it is that you're going to suffer consequences as sensory deficit or even motor problems like weakness in the legs or weakness in any particular muscle that that nerve happens to be connected to. And unfortunately, it takes a long time for that nerve health to come back, the nerve flow to come back once it's been pinched for a while. It takes a long time. Typical repair on a disc herniation is a year. And it doesn't matter if you've had conservative treatment or surgery. Once that nerve has been pinched for a while, it's going to take time for that nerve flow to come back. The worst thing that can happen to a disc is called sequestration. So sequestration is when the disc basically just fractures. The problem with that is little bits and pieces of the disc will go all over the place, and unfortunately that's usually a surgical situation. You have to go in and remove the pieces. Signs of sequestration are loss of bladder function, loss of bowel function. There's a syndrome called Cauda-Equina syndrome that is diagnosed for that particular situation. That's a surgical case. Treatment for disc bulges, for disc herniations, can go many different ways. The conservative route is to basically try and remove the pressure that's causing the disc bulge to begin with. So you've got to look at the alignment, you've got to look at the motion of the segments, you've got to change the pressure on the disc that caused it to begin to break down and bulge to begin with. Chiropractic is fantastic for that because that's our main thing. We look at alignment, we make sure that the vertebrae are aligned properly and moving properly so that there's not this abnormal stress on the discs. We also implement stretching so that we can relax the muscles in the area and decompress the area with traction, things that basically change the mechanics inside the disc that are causing that disc bulge to begin with. The next thing that may be done besides core exercises would be to get an injection. So if there's a lot of inflammation in the particular area, then if you do epidurals or pain injections to handle the inflammatory part of it, that can be beneficial as well. Finally, if nothing else is working and the pain continues to get worse and the radicular symptoms or the nerve pinch symptoms continue to get worse and you start to get weakness in the muscles, then seeing an orthopedic surgeon or a neurosurgeon to get a surgical consult to make sure you don't need surgery. Surgery is the last result. You want to try all conservative means first. If there's nothing else that's working, then seek the consultation of a surgeon, and you might have to have some sort of surgery, be it laser surgery or open surgery to reduce the herniation. But an MRI is generally required before that. In our office, we typically will treat for 2 weeks conservatively, just based off of our findings on x-ray. If you're not responding like you should, or if we're not decreasing either the spinal pain or the nerve pinch pain, then we send out for an MRI to see exactly what's going on with the discs. And based on what we see with that, we make our decisions. If you're suffering with any problems with spinal pain or nerve-related pain, such as numbness, tingling, weakness, give our office a call. We are located in Orland Park. Our phone number is 708-403-2727. Nice talking to you.